If you're an IMG who's working in the UK and want to get into emergency medicine training here, today I'll be breaking down the process into 3 basic steps. There's a lot of information out there. It can be really confusing and overwhelming, and it's important to just focus on the basics while going through the process of applying into specialty training. My name is Hassan. I'm an IMG who came to the UK in 2022 and started my EM training in 2023 as part of what is known as ACCS. So today I'll be running through the 3 basic steps that take you through the emergency medicine training program. The first step that you need to do is to get your CREST form signed. Now I know that to some of you already know what the CREST form is and you've already signed it, or you find that this step is quite basic. I have come across a lot of people that believe it's straightforward, and then months later they've still not signed it, and by that time the application has started and they've missed out on this year and they have to wait another year. And that's why I emphasize on making sure that it's signed by the time the application process starts. So what is a CREST form? CREST form stands for a certificate for readiness to enter into specialty training, and it's a form that consists of 3 essential parts. It is signed by a consultant. It needs to be signed by a consultant, and I'll get into that in a bit. So the first thing is that the consultant must have worked with you for at least 4 months, and they can use information that they've seen, the work that they've seen you done, as well as ask colleagues for some input on your performance into 3 basic domains. The 3 domains have to do with you being an accountable doctor who is part of a workforce and is responsible for their own development. That includes portfolio as well. So the best way to go on about this step is to first identify the consultant who is going to sign your CREST form. And the reason I say that is that it needs to be a consultant on the specialty register. Not all consultants that you're going to work with are actually on the specialty register. And what that means is people who do a certificate of completion of training or have their CSER completed are the ones that would be on the specialty register on the GMC website. And only these ones, unfortunately, are the ones that are able to sign your CREST form. So the best way to go on about it, go on the GMC website, type in the names of the consultants that you work with, and find out who of them is on the specialty register and is able to sign you off. After that, you can approach them, formulate a plan, give a timeline, and ask them what they need of you in order to get it signed. Now there are a few more eligibility criteria for you to apply into EM training, and these are quite generic compared to other specialties. They're not really that extensive. The majority of them have to do with being active on your portfolio with CBDs, with DOPs, and showing some level of activity in QI projects or audits, even if it's just as simple as data collection or something like that. Some of the desirable criteria when you're doing your application process include things like doing the basic ALS courses, pediatric ALS, and attending any conferences. And the reason I mention these things is because the application is becoming more and more competitive. So just doing the basics, unfortunately, is no longer enough. So the more that you have, the better. But as a start for you, if you're still not sure where to start, just focus on the basics first. Get a portfolio going, have a lot of activity on it, get involved in some data collection for QI projects or audits, and finish a cycle or do a second cycle of an audit. The actual application process starts at around October to November, and this is when you will apply with all the paperwork, upload your CREST form, and show that you have the essential criteria. You can even demonstrate the desirable criteria. So that is the first date that you need to have in mind. before November or October to November, you should have your CREST form signed and all your papers ready. The second step is, and arguably the most important step, is sitting the MSRA exam. So MSRA stands for Multi-Specialty Recruitment Assessment. It's an exam that includes both a clinical part as well as a sort of situational judgment test. And it began as an exam that was for GP trainees to enter into specialty training, but expanded and is now being used by multiple specialties, EM, anesthetics, even pediatrics, and many, many others. Up to recently, it's now part of the surgical application process as well. So the exam essentially focuses on basic clinical skills, basic clinical scenarios, as well as what is known as a situational judgment test, where you are mostly answering questions about confidentiality, about communication with colleagues, incidents, and things like that. So I personally used two sources for it. For the clinical part, I used Past Medicine, and I thought it was really good. And that was the first part. And the second part, for the situational judgment test, I was recommended by a friend at the time to use the MCQ bank. It's been more than 2 years since I've done the exam, so there might be some updates in terms of sources, but I think if you really study these sources properly and go through them multiple times if possible, and go through the questions as much as you can, then that should get you a good enough score. The MSRA exam is usually around January, and the reason it's being done for so many specialties nowadays is it's really become a method of cutting down on the number of applicants for competitive specialties in order to come up with a number that the colleges are able to interview and give spots to, rather than have to interview thousands of people who are now applying. So this brings us to the third step, and the third step is going to be your interview. Traditionally, the MSRA exam makes up around 60% of the grading scale that you're going to get for your application, and the interview makes up 40%. So the interview is usually around 20 minutes. It will be with 2 consultants and sometimes a third doctor who's attending for the purposes of observing, but they will not be actually involved in the interview. There will be a period of 10 minutes after you've finished the interview where the consultants will discuss the outcome of your interview. They will grade you, and that's how it's usually done. In the first 20 minutes where you're attending the interview, there are a few parts that you will have to talk about. The first part of the interview is going to be a clinical scenario. Typically, it's usually a scenario they'll give you some history about a patient and ask you to manage the patient. So what you're going to do is run through an A to E assessment with both diagnostics and management as you go along with each step, and showing an understanding of management, diagnostics, place of disposition, that means where the patient should go to, which specialty, and also demonstrate an understanding of how sick the patient is, whether you need some senior help early on, and what kind of specialties you would have to discuss the case with. After the clinical part, typically you would also be talking about your commitment to the specialty. So when it comes to EM, a few ways that you can show your commitment to the specialty is attending the basic ALS courses, and that includes not only ALS but pediatric ALS, ATLS, and if possible any conferences that are EM related, that would be even better, and that would take it a step further. In terms of exams, strictly speaking, it's not one of the essential criteria in the interview to show that you've done EM exams already, but I think that just given the level of competitiveness that is going on, if you're somebody who has a period of time at the moment where they're maybe getting their crest form signed, not done the MSRA yet, still, the beginning of the year, then I think it would be a good opportunity to try and get the first MRChem primary done. That would really show a really high level of commitment to your specialty. And I personally hadn't done it by that time, but I'm just being mindful of the fact that it is getting more competitive, and I can't just simply give you the advice that worked for me and is still going to work for you. These things change with time, so I'm just trying to see what can help you even further. Another thing that you might be asked to talk about is generally about your achievements, your CV. Now, really, this is a time where you should not shy away. You should demonstrate your achievements, whether they're medical or outside of medicine, but contribute to your medical knowledge and experience, and just show your achievements. Don't be too humble about it. This is the time for you to actually brag about it, about the things that you've done. They need to see some level of confidence in you. Another thing that you might be asked about is your knowledge of any pressing issues in the Department of Emergency Medicine. So things that you've read about that are major issues in emergency medicine in the UK, whether it's long waiting times, lack of bed space, any particular issues that you've come across, just to show that you're up to date with the most pressing issues in emergency medicine. Now, the parts of the interview that I've spoken about may not be in a particular order, so there's no particular order to them. Just the main thing is to prepare as much as you can. Once you finish the MSRA exam, you need to just sit down, know the parts, and start practicing your answers, and so that by the time you're doing the interview, it's more natural, rather than maybe forgetting to talk about some parts that you're actually good at, or that you've read about, but you just on the spot would not be able to remember them because obviously you're a little bit nervous. So there it is. These are the 3 essential steps of the application process. It starts usually with fulfilling the criteria and submitting the application at around October to November, sitting the MSRA exam in January, and then moving on to the interview usually is around mid-February. This is your timeline. Just be organized, put all your energy into the first step. Once you're through that, into the exam, and once you finish the exam, already start preparing for the interview, and hopefully you'll get your match into EM training. So best of luck to all of you.